Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers, and today a conversation about the future of public health with the future of public health. Nayesha Diwan is a rising high school junior and a public health advocate. Her work includes serving on the UN's Global Youth Excellence and Leadership Program and hosting her own podcast, Global Health Frontlines. We talk about how her passion for public health started, what she's learned, and what she's most hopeful about for the future. Let's listen. Okay, so to start off, why don't you tell everyone your name and where you are right now?
Yeah. Hi, I'm Nayesha Diwan, and I'm currently in Chicago, Illinois, doing an internship.
What's your internship?
I'm actually doing an internship at Northwestern about electroneurophysiology and schizophrenia.
What is this? What do you do at this internship?
Actually, yesterday was my first day, but I get to observe how they test animals, cut open animal brains. I know that sounds gross, but then how they analyze each part of the brain and then make real life connections. And then also all the calculations, like just yesterday, I got my own lab notebook. So I learned how they record things, in case the computer crashes, and how even though technology is so advanced, people in labs still stick to the old fashioned methods of using paper and pencil.
It's amazing that you're getting this experience. And so tell us, are you doing this internship for school?
No, it was just because I'm really passionate about public health and neuroscience. I thought that I may not get an opportunity like this again in the future because of the way funding has been cut. And I really wanted to learn more. I wanted to develop more research skills because I'm a really curious person. I always want to know more and more and more. And this is just so interesting. Imagine getting the chance to work alongside a professor in a lab, all the dangerous solutions in the lab code. It's pretty cool.
Now, this is a question I don't usually ask our guests, but I will ask you. Would you tell us how old you are?
Yeah, I'm actually 15.
And what grade are you in school?
I'm a rising junior.
You reached out to us, I think, several months ago now and said, you introduced yourself and you said, I have a podcast. I'm really interested in public health. I'd like to know more about what you do. And so you and I met virtually and started chatting. And you told me that this interest in public health actually started from a very young age. So would you share that story?
Yeah. So I think I was in 5th grade when my mom was diagnosed with stage 3 breast cancer. And I kind of saw a lot of gaps in the healthcare system, the way they weren't giving as much priority to my family's mental well-being. There's still that sort of stigma around mental health. And I was able to experience that firsthand when my mom was going through treatment, that, our family, we kind of broke down as a whole. We'd never experienced something like that before. And at a young age, I was just inspired to make a change. I was like, I want to change this. I care about the mental health of others, and that experience changed the way I looked at things. It completely transformed my worldview, matured me as an individual. And overall, I just started looking at things a different way. And it inspired me to make a change, especially for people from underserved communities who don't have equal access to healthcare. Because my family was very fortunate that we had good health insurance and good access to healthcare. But it always made me wonder, what if, my parents didn't have such good jobs? What if we didn't have this kind of insurance? What would we do? Because there are so many people out there who don't have good health insurance, who, worry every day, what if something happens to my health? I won't be able to pay for this. And it kind of made it feel like healthcare is a privilege and not a basic right. And that is not the way it should be. Healthcare is a basic right that every human deserves. And And I think that's why I was so inspired to get into the field of public health.
And so through your family's experience with cancer, you saw some gaps in resources, like the emotional impacts of cancer on the family and how everyone was coping with it. And then you also saw like what services you did and resources you did have at your disposal, and just imagining what might have happened if you didn't have those things, and understanding that there are so many people that don't have that. And so tell us then how that inspired you and what was your next move after that?
Well, my next move was I actually started looking for volunteer opportunities around me in ways that I could make maybe like a small difference. So I volunteered at Influence to Choice, which was an organization that kind of advocated against substance abuse in youth. And, I got to learn a lot about the fentanyl crisis and how many people are impacted by it. I also got a lot of exposure to the different mental health problems out there like depression, anxiety, right? And I was able to familiarize myself more with those disorders and what people go through, right? And I worked with Influence the Choice. I was in 7th grade and I'm still working with them now. And I've learned so much. I even got to go to Olympia, which is the capital of Washington State where I live, persuade senators to make changes in policy so that fentanyl is not as easily available for youth. So I think that was the first taste I got where I actually felt like, wow, I've done something. I was able to kind of make a change.
So you spent your middle school time with legislators talking about fentanyl policy and substance use policy. Where did your public health work take you then?
After that, I continued ITC for a while. And then in my freshman year, I kind of started focusing more on academics. And then I was taking competitive biology exams because, I was set that, I'm going to do something in the field of medicine. I wasn't sure what. So I was exploring. I took the USABO, and then which was a competitive biology exam. So I studied for that. And that took up a lot of my time. So then in my sophomore year, I went on to do the Global Youth Excellence and Leadership Program, the GYEL program, which focused on the UN's 20 Sustainable Development Goals, which they want to achieve by 2030. And the SDG that stood out to me the most was SDG 3, which was good health and well-being. And with that, I got to dive deep on case studies, areas where people have come out with projects, like, for example, how telemedicine has made a difference in some rural communities. I got to explore these kinds of case studies and then learn how to think about policy and learn what current leaders are doing to help make a difference, what the UN is doing and how it's coordinating these things. So over there, I worked to build a foundation in the field of public health, how it works, and how you should really think about these things, how you should approach them. That gave me a lot of exposure. I honestly think that was, in many ways, a life-changing program because it really exposed me to different parts of the world and how different things are for people in different communities. We didn't just focus in on one SDG. I got to learn about women's rights, climate change, everything, because in some way, everything is sort of interconnected. At the end of the day, public health is not just healthcare. It's everything. There's so many elements that make up the field of public health.
So you had this experience with the UN and you get to kind of see how public health is playing out in the world. Tell us a little bit about your podcast.
Yeah, so my podcast, the name of my podcast is Global Health Frontlines. And I've produced about 6 episodes so far. 2 are on the fentanyl crisis, on body shaming, and then we've done 2 on the vaccinations. And I'm using this platform to kind of dive deep into various health issues with a focus on mental health. Because I think after seeing mental and emotional toll that my mom's illness had on our family, kind of determined to shine a spotlight on the critical importance of addressing mental wellness alongside physical health. It's kind of been a labor of love so far. Only managed to produce 6 episodes, but I'm definitely going to do more. And I'm excited to expand the reach and the impact of this project.
And so what do you think, especially in this moment, what do you think is important for people to understand about public health?
I think that it's definitely crucial for people to have a deeper understanding of public health because it's a field that directly impacts all of our lives. And, we may not completely appreciate it, but it incorporates a wide range of initiatives and interventions like disease prevention to like health promotion to environmental protection and the development of life-saving technologies, right? And then when people are able to grasp the scope and the importance of public health, they can sort of better understand how the decisions that are made by policymakers and researchers and like healthcare professionals, how those decisions sort of ultimately affect their own well-being and that of their communities. And I think that this awareness can empower individuals to become more engaged and advocate for positive change and also kind of take an active role in maintaining their own health. Because by understanding how public health systems work, people can develop like a more nuanced appreciation for like the challenges and the complexities that are involved in addressing global health issues. And then they're able to like recognize that there are no easy solutions and that progress requires a collaborative and a multifaceted approach that kind of balances scientific innovation or policy reform and then, of course, equitable access.
What are you hopeful about?
I think I am the most hopeful about all of the inventions and changes that the future has to offer. Now, I don't know where the world's going to go. I don't know what the world's going to look like in 30 years. But I hope that people stay curious, people keep trying, and I hope that opportunities stay open and that one is never blocked from thinking, following their passion, and whether that passion is going into a lab at 15 years old or recording a podcast or, I don't know, painting, dancing. I hope that people are always given the freedom and the flexibility to explore their passion, explore themselves without any judgment. And the world continues to grow, thrive, and yeah.
Nayesha Diwan, thank you so much for joining us on Public Health on Call.
Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.